Hi, my name is Gabby, and the disease I chose today for this project is called acanthamoeba keratitis. So, what is acanthamoeba keratitis? Um, it's an infection that damages the cornea of the eye, and even though it's rare, it can become more serious if it is not diagnosed or treated. Um, in early stages. The organism that causes the infection is called acanthamoeba. It does not cause the problem until it gets into the eye. As you can see, this is already with the disease, how the eye changes and it's affecting the eye. So where is acanthamoeba found? Here are some just pictures of where in soil, lakes, rivers, swimming pools. So the reason this infection is difficult to prevent is because acanthamoeba is found almost everywhere. And most people come into contact when with it without getting sick. Um, so the problem happens when it enters the eye. So through contaminant contact lenses, um, the eye the eye has to have like a small injury to the cornea, so it could infect the eye, I guess, or like it could damage the eye and cause that disease. Um, but as you can tell, it is found in soil, lakes, rivers, swimming pools, tap water, hot tubs, air, and dust. So like almost everywhere. But I mean, nothing happens when unless it gets into your eye, into your cornea. So, who is most at risk? So, although this could develop infections, anyone can develop infections. So, contact lens wearers have the greatest risk wearing contacts. So, like I said, if your eye is like your cornea of your eye, if there's a scratch, you scratch it, and then that the infection gets in your eye, then that causes it. So like when wearing contacts while swimming or rinsing them with tap water, like for example, you don't have solution and rinsing them with the tap water, all of that, the infection or the disease is everywhere. So remember, it's everywhere. So you thinking that tap water is okay to be used with your contacts and be mixing them together, that is not true, because it does have can cause the acanthamoeba keratitis, and it could get to your eye because of how you're managing your contact lenses and everything. So with that being said, a little insight of it is when when you're rinsing your contacts to the water, you're allowing the amoeba to attach to the contact lenses, and then when you place them in your eye, you're contaminating your eye, or you're contaminating the contact is contaminated, and you're contaminating your eye, and then the organism can enter through any tiny scratches in your eye, and then there you go, there you have it. So that's how why contact lenses users are higher risk, because you're directly putting stuff in your eye. So that's, yeah. How does the disease develop? So the acanthamoeba first enters through the corneal scratches, attaches to the corneal, and damages the outer epithelial layer. It then breaks through the Bowman's membrane and spreads into the stroma, where it destroys corneal nerves, usually causing severe pain. Although it usually remains confined to the cornea, it does not spread inside the eye, so it can lead to permanent vision loss. If you left untreated. Like we said, if you don't treat it, then you're damaging the eye. It's like you're not doing anything about it. It's getting worse within time. So signs and symptoms. These are like the stages of how it works, right? So the symptoms for acanthamoeba keratitis often look like other eye infections, so it's frequently misdiagnosed. Many people first notice severe pain, so redness, blurry vision. The pain gets worse, right? Because the amoeba is damaging the nerves in the cornea. As the infection gets worse, the eye becomes more sensitive to light. So when you go outside, the sun, it hurts your eyes. You find your eyes are more sensitive, like to bright lights or the sun, right? And vision, your vision obviously continues to get worse and it declines. Like you slowly get like you're getting blind, you know. So these are like some of the people's eyes, like the stages: A, B, C, D, E, F. So these are some of the people's eyes of how they develop within time as you don't treat them. So the secondary complications, if the infection is not treated quickly, it can permanently damage the cornea scar tissue, may block vision, and some patients may require a corneal transplant. So to restore eyesight even after the treatment, in some cases, patients continue to have vision problems. So early diagnosis and treatment provide the best chance for recovery. So the faster you treat it, the better chance you have for the recovery, like saving your eye. You know, you don't lose an eye, but like the more you take to like treat it, then the more damage it does to your cornea. So how it's diagnosed. So obviously, as you can tell, you have to go get examined, right? So doctors start by asking about the patient's symptoms. So like whether they wear contacts or not, or during the exam, they may notice damage to the cornea. So when they're checking, they confirm, right, the diagnosis. They can collect a small sample from the cornea and test it in a laboratory. Confocal microscopy allows doctors to see the amoeba directly in the eye, while PCR testing detects the amoeba's DNA. Early diagnosis improve. So DNA. So early diagnosis improves the chances of saving someone's vision. So obviously, they ask you how long have you been wearing contacts. Obviously, they're gonna ask you if you're keeping up with like the hygiene of your contacts, like your like cleanliness and everything. That this brings me to the next slide. So the treatment and prevention, right? So when you're treating it, right? So treating the acanthamoeba keratitis, so can take several months. So it is not something that you can treat within 1 week or two. It takes time because once you have it, it's not easy to like remove or like get rid of like a fever or like a different symptom that you may have, like you get sick, you have the flu, you know. It's not easy to treat, but it could take several months. The amoeba forms protective cysts that are difficult to destroy. Patients usually need special eye drops several times a day. If the cornea becomes badly damaged, a cornea transplant may be necessary. Like, so if it's at a point where you took too long to get it diagnosed and treated, then you may need a transplant then after that. So but the best treatment prevention is by practicing proper lens hygiene. Simply start by like starting to wash your hands before you even think of like putting on contacts, taking off contacts. So because all of that, if you have dirty hands and you take off your contacts, obviously the dirtiness of your contacts, it's gonna show. You're gonna keep it in your contact. It's gonna look like this, similar like this. So washing your hands, avoid using tap water. Although it may seem clean, like I said, like tap water is not clean. It's not safe to use with contacts. That's why there is solution to switch out and, you know, change all the time and never use, right? Switch up your contact cases. That is something, that's a big one. A lot of people think that by just having them there and not switching them every few months, right? You switch them out to prevent that. Also, do not shower in your contacts because all of that you keep on contaminating your contacts, and it's like a cycle. Like you're dirtying them one way or another. For everything you're gonna do, like whether you're gonna shower that you know there's a chance that there's water's gonna come in your eye or something else is gonna, you know, get in your eye. That's something where you need to take them off and avoid getting it contaminated. Or when you sleep, do not sleep with contacts, you know, or swim. You know, there's a lot of bacteria and nice nasty stuff there. So interesting facts. One of the most interesting things about Xanthomoeba has 2 life stages. It's one that's called trophozoite active stage, that feeds on the cell, while the cyst stage acts like a protective shell, allowing it to survive harsh conditions. So it's like resisting treatment. So reason why this is one of the reason why the treatment lasts so long, because it's like it's resisting. It's like it's not allowing it to heal, or it's like this is one of the reasons why it's like difficult to kill, I guess. And a reason that's difficult to kill. So yeah. So the next one, interesting fact about me, that I used to wear contacts, and something that I didn't really like, because it's like, yes, it takes time to like keep up with hygiene, keep up with the cleanliness and everything. I did have contacts since middle school. So okay, this is my personal stuff, my personal experiences, in fact. So I did have contacts since middle school, but I did get LASIK done. So that is something that I don't regret, that I really like, because ever since LASIK, I do not have to like deal with contacts anymore. And before this project, I didn't know that how important it was to deal with contacts, and like what can cause, like what disease it can cause, and it can cause it could cause me to be blind, I guess, within time, if you don't take care of yourself. So I did decide in 2023, not because of this, but if I knew of this sooner, I probably would have done it sooner, or I probably would have thought about it a long time ago. But I just did it because my vision wasn't all that good. But I did it in 2023, and I did it with I got it done by Dr. John Brewer. This is a picture of me laying down. Here in this picture, he's like slicing my my eye, my cornea, with for the flap. He's taking off the cornea flap to like shave down the blindness, I guess. I'm not sure how that works, but and then this is before with glasses, me, and then this is after me without glasses. Like I didn't need it. I could immediately see after, like, and this is something crazy, but this just shows me how important it is to keep up with contacts, you know, be aware of how important it is to stay always on top of the cleanliness, the hygiene, and how important it is to understand that using contacts is not easy. It is, people do not take it serious, but it is something serious. It's rare, like I said, it's rare, but it is something that could happen to a lot of people, and that mainly people that wear contacts, which it could have happened to me because I was like that once before when I was in middle school. I did not know about this. I wasn't aware, and it kind of shocked me because that could have been me. That could have been me. I could have been blind more than I was already, but because of the hygiene, because of the, you're not on top of it. But I'm glad that I know now. And if I ever have to go back to my contacts and my vision goes back, then I would know now to how to prevent and how to maintain contacts, and how important it is to avoid having the was acanthamoeba keratitis, But yeah, I mean, that's all I learned from this project, and I hope this kind of helped whoever's watching my presentation understand it a little more and realize how important it is. So, and these are sources that I used. I think I did use some, but okay.